Hello, everyone, and welcome to our panel today. Before I give the word to our North California chapter members and our panelists, I wanted to give you just a few instructions on how to use the control panel on your right-hand side. I'm assuming it's on the right-hand side. You have the option of choosing the way you want to listen to the audio, computer, or phone call. You also have the option of submitting your questions in the question section. Please note that you will not be able to see other people's questions, so don't be confused by that. Today's presentation is being recorded and it might be posted on YouTube, EERI National's YouTube channel within a few weeks. One more thing, today's session will have video because it's a panel, and you will have the option to select who you want to see. As you can see, it's above your camera view. Right now, it's probably set to everyone. So please ensure to make view who's talking just so that you wouldn't see all of our panelists at once. It might be a little bit confusing. And from here, I will give word to Volkan Seviljan.
Welcome, everyone. My name is Volkan Seviljan. I'm the president-elect of the Northern California chapter of Earthquake Engineering Research Institute. I would like to give you some idea about where we are located. We are located in the San Francisco Bay Area, and we have about 200 members that are mostly geoscientists, structural engineers, but we also welcome anyone who would like to join our chapter that from all walks of life and to contribute to our common cause. We normally organize a lot of in-person meetings, and they are really been fun, and we really enjoy those. But for the obvious reasons, we now have to switch to a new platform, and we would like to take advantage of this new platform to make it very easy for everyone globally to join our meetings. So with that, I would like to give the voice to Bruce. So we have two panelists today. We have Bruce Mason, who is our secretary and treasurer of the chapter, and we have Rob Oslansky rather. He is member of our board of directors. So Bruce, you are muted, I think. You are probably muted.
First virtual event. We will be doing more of these things in the near future. Our panel event today is very timely, for it has the theme, how does a pandemic affect emergency response following an earthquake? Our four panelists today are, the first is Ann Rosinski. She's with the FEMA Regional 9 dealing with natural disasters. The second is Kevin Miller. He's with the California Office of Emergency Services. The third is Bijan Karimi. He is with the City of San Francisco Office of Emergency Services. And the fourth is Professor Louise Comfort. She's with the University of Pittsburgh, the Graduate School of Public Affairs, and her research interests deal with earthquakes. Now, what we've done is we've asked each of them to make a brief opening statement about how they are involved with our theme today. Then I will pose several questions, and then I will turn control over to Rob, who's monitoring the audience questions, and he will pose several additional questions. Now, we hope that our session today will be 1 hour, but it might run over a little bit, maybe 10 minutes or so. So if you have to leave at 1, feel free to do so. Now, what I would like to do is turn the platform over to our first panelist today, Ann Rosinski, to talk a little bit about her involvement with our theme. Ann, please proceed. You're muted.
There we go. Better?
Good.
So my name is Rozinski. I'm with the Federal Emergency Management Agency, Region 9, and I'm the Earthquake Program Manager. I'm a licensed engineering geologist. My area of expertise is liquefaction. I spent a number of years working for the state doing liquefaction hazard mapping and seismic hazard assessment. And in terms of how do I, rate for this conversation today, well, I say I'm an engineering geologist, not an epidemiologist or a, infectious diseases expert, but I was deployed out to Guam for 2 months in the FEMA IMAT team to support the COVID response out there. So I've been dealing with this pretty directly, and it's been really educational.
Okay, great. Great, and thank you very much. I would like for Kevin Miller to say a few words, please.
Thank you. I'm Kevin Miller. I'm the Earthquake, Tsunami, Volcano Program Manager for the California Governor's Office of Emergency Services, Cal-OES. And really our program's mission is to support the agency's larger mission of protecting life, property, and the environment in California, and then further to focus on fostering a culture of earthquake and tsunami readiness and resiliency in California. And our strategy really covers all aspects of the disaster planning cycle, from response to preparedness, mitigation, and recovery. We work to secure grants and funding to support all these efforts, a variety of projects that include supporting the Great California Shakeout. I think we're mostly, a lot of us are familiar with 10 million Californians support that or participate in that every year. We also have a focused effort in the spring, Tsunami Preparedness Week, which allows us to focus on that hazard. And we support Earthquake Country Alliance regional preparedness groups in the state, in the Bay Area, in Southern California, and on the North Coast and elsewhere. Really, we have been operating remotely since the second week of March, and our operation is well positioned to do that, in that we have staff in Southern California, in the Sacramento area, in the East Bay, where I am sitting right now, in the Bay Area, and on the North Coast. And so we're used to communicating and using our capabilities to respond. We have a 24/7 duty officer program that is geared to providing a liaison between the science and emergency management decision makers. And I can speak to that a little bit more as we go on. So I'm happy to be here today, and thank you.
Thank you, Kevin. I'd like for Bijan to make an opening statement, please. Bijan. Unmute. Unmute. Bijan, please unmute.
While we are getting Bijan's voice problem solved, maybe we should skip to next panelist.
Yes, Louise, until Bijan can straighten it out, please make opening statement.
Hi, I'm Louise Comfort. I'm a professor at the Graduate School of Public and International Affairs at the University of Pittsburgh, actually part-time now, with a career of 30 years plus in looking at decision-making in disasters. And I focused on earthquakes because earthquakes are extremely complex, very interdisciplinary, and have major impacts on the community. I've actually done 23 earthquake response studies in 14 countries. 3 of those have been here in California, and California is home for me, which is where I am right now in Oakland, California. And my real interest is in the complexity of response operations and how decision makers in multiple organizations need to coordinate their decisions simultaneously in order to bring an incident not only under control, but to anticipate the likely cascade of consequences that comes from that. In this study, I've been particularly focused on communication. Communication, as any disaster manager knows, certainly Kevin and Ann know that, is critical. And one of the things that has happened in the last 2 decades is really the change in communications and the capability of communicating much more quickly and much more readily to many more people simultaneously. However, this does also raise the possibility of increased chances of error in communication. People are communicating with one another. There may be erroneous communication, outdated communication that is circulating that makes the difficulty for community response makes community response much more difficult. So I'm particularly interested in COVID-19 and looking at the communications processes that are necessary, because not only do we have multiple forms of communication, we have multiple actors who are using those forms of communication and sometimes giving conflicting messages. Also, it's really critical in emergency response. While we have a very well-known, established pattern of emergency response with the Incident Command System, and in California, SIEM, Standardized Incident Command System, it really needs to collaborate very closely and carefully with the public health system. And in many respects, decisions are made at the county public health level. They're not necessarily brought into the emergency response operations centers that are organized by Cal OES, for example, and really aligning the communications between the public health system that has its own response operations with the emergency management system is really critical. And as we all know, in earthquakes, our alert time, our anticipation time is very short. So this is something that needs to be done ahead of time. And I'm very eager to hear what both Kevin and Ann have to say about how Cal OES and FEMA have been anticipating this interconnection between public health and emergency response.
Excellent. Bijan, do you have, can we hear you?
How about now?
I think so.
Great. I'm going to minimum.
Okay, please make your opening statement.
Take care of some background noise. Thank you, everyone. And one of the things we do in emergency management is come up with alternate solutions. Thanks to EERI and the Northern California chapter for inviting us to participate. During the everyday emergency, I am with my team. We're using threat and hazard information in order to develop our training, planning, exercising program, and then our operations. In the last 4 months, actually 6 months for us, because we started all the way back in January, we have turned to a totally response environment. You can see where I am is in Moscone Center, where we have 600 people in an emergency operations center, but all socially distanced so that we can make all the connections that we need and all the operational decisions in a real-time environment. Technology is great, but it has still certain limitations. One of the things that we look at when it comes to emergency management is a concept of cause and consequence. In many cases, the causes are going to vary, whether it's an earthquake or it's COVID, but the consequences of how we're going to be managing our interaction with the public, feeding, housing, sheltering, all those components, that's what we're focusing on now. How do those responses get modified? Know that we may have an incident on top of an incident, and that's where we get to our earthquake, or it could be air quality, or it could be heat. All of those are going to be impacted by the current COVID environment that we are in. And we look for what guidance our partners provide us from Ann at FEMA or Brian, at Cal OES. I know FEMA just in May released their information on how to deal with hurricanes during COVID. Well, an earthquake isn't a hurricane, but that's a cause. The consequence is people are displaced. They need to go somewhere else. So there's still a lot that we can learn from their experience. Thanks, Bruce.
I can't hear you, Bruce.
Oh,
Now we can, I think.
oh, can you hear me now?
Yes.
Okay, thank you. Okay, we'll start with the questions. The board came up with several questions, and I will ask several of them. The first one is kind of a very general question for our panel. In other words, how much more difficult does the pandemic make the emergency response actions? At first, we'd like for you to give a number rating to it. 1 would be little to no effect, or 5 is extremely more difficult. And then if you could, just mention one of the challenges that influenced your rating. So anyone can start. Anne, why don't you start?
All right, make sure I'm on. So definitely 5, like infinity 5, beyond 5. For FEMA, one of the challenges is that we need to, we deal with seasonal disasters and we need to maintain readiness for other types of disasters. And now all of a sudden, every state in every region, all the tribal nations, all of our territories simultaneously declared a federal disaster. So that's unprecedented. So we need to maintain 2 different levels of readiness. And I think I'll leave it at that.
Okay. Okay. Who else? Kevin, perhaps? How would you rate it?
It's interesting. I gave it a 3, but I guess that rating is subjective. It has definitely impacted our operations significantly. The agency has had to do a couple of things. It's affected staffing. Basically, everyone was sent home the second week of March. And at the same time, we have to have a state operations center operating, supporting 157 emergency operations centers that are operating within the state of California, whether it's a state, federal, local level, and medical health level. All those operations are coordinating with the State Operations Center. The California Department of Public Health is jointly releasing, daily situation and operating in conjunction with Cal OES, and so it's just facilitated a paradigm shift in the way that we have had to operate and maintain. There's a core of about 120 people that are supporting the State Operations Center who have to do the opposite of what everyone else is doing, is work from home. And that's a continuous operation that's been going on for 4 months now. There are 3 teams, red, white, and blue, that are rotating on a 2-week basis, that are rotating in for that operation. So we've also put in place some contingencies in terms of planning for concurrent disasters, whether it's public safety power shutdowns that we experienced in the last couple of years that we can potentially anticipate, this summer and fall, from wildfire threat to an earthquake happening. So there's a lot of moving parts, but we are really, it's something that the agency is able to walk and chew gum at the same time, basically, to use that overused phrase. But we've seen it in terms of the COVID experience happening at the same time as civil unrest going on, and different levels of activation have occurred. A lower level of activation for the support of of civil unrest and continuing operation for COVID going on at the same time, as well as various other, incidents that pop up around the state, whether it's a small fire or something else that needs to be supported. We also have the State Warning Center that's 24/7, 365 that's monitoring anything that could pop up as well.
Sounds like a lot. Bijan, please.
Yeah, so in San Francisco, it's interesting what both Kevin and Ann talk about. When the event first happened, we're dealing with an event that most people aren't familiar with or aren't comfortable with. They cannot touch it. If it's an earthquake, I can see something is broken. I can see a building is down. There's infrastructure that needs to be fixed. I cognitively get it, and I understand what needs to be fixed. But we're in an environment where, in San Francisco, our first dealing with it was with the xenophobia and appreciating that the people who may have had this disease and were bringing it were people that were traveling to the area, not people who may have ethnically been from that area. And so the communications that we need to begin with. So public information was really our huge focus in the first month and a half of what was going on. And as we transitioned into the response, it was education of our responders and how their roles are going to change. We really focused on the most vulnerable populations that we had, but also on worker safety. That's why we're here in Moscone Center instead of in our regular emergency operations center, so we can be further apart and maintain the social distancing, but then focusing on the disease itself and what that transmission was going to look like. And we've had to modify all of our housing, all of our sheltering, so that we can ensure responder safety at the same time that we are helping individuals. And we're also coming into an environment, though interestingly like an earthquake, where the amount of infrastructure we have, in this case hotel rooms, there's only so much to go around, and there's only so much money to be had to pay for those. And so the economic output or decrease that we are now faced with, that is helping us, one of the factors that we're considering when managing the resources and what we're going to be able to provide. And so where before, maybe the concept was this will be a several month thing, like in an earthquake, but we will see progress. The mindset that people have had to get into now of knowing that this is going to be a quarterly, seasonal, annual thing until we kind of get a hold of this, that's been one of the biggest things that we've had to overcome. Now, our departments have gone back on their continuity of operations plan. What are the essential services that we provide? Who can provide them? And what level of staffing do we need to maintain physically, or who can do the work from home? And as both Kevin and Ann mentioned, if people can do it from home, great. But there are some people that still need to come in and do their jobs. Bruce?
Okay, Bill, Bijan, what was your ranking? I'm just curious, between 1 and 5 in terms of the additional effort.
I dodged that question because, like Ann, yes, I like that 5 infinity. This is just something that we haven't dealt with because of the scope. As Ann said, this is a national and international thing. It's a tough one, certainly.
Okay, very good then. Louise, please. You're muted. Louise, you're muted.
Unmuted. Okay, good. Sorry. Oh, well, this has been fascinating for me to watch because I've been looking at decision making at multiple scales. And I would certainly agree with Ann. For me, ranking it, I would give it 5 to infinity because I'm looking at it at local, and I'm in Oakland, so City of Oakland, then Bay Area, then California, then the US, and then internationally. But I think that California has significant advantages as a state over some of the other states because the state as a whole has been able to pull together an operation. I'm really empathetic for Ann because you're dealing with multiple disasters, multiple hazards, and states with very different practices and very different patterns of communication with their constituents. Here in California, I do believe the governor with his daily newscast has managed to pull together a sense of commitment from the citizens that has been very important, even as we've seen different patterns of the spread of COVID-19 in different parts of the state. Los Angeles, much higher than here in the Bay Area, but still, when we recognize that California faces on Asia, and some of the first cases came in from Asia, but it also faces on Mexico and Latin America. And so the level of exposure in California, and I have to say it also borders on Arizona, which had a very different set of policies in reference to the disease, it makes it a much more complex, much more challenging set of operations to put in place. And the critical piece for me, and I think this is really interesting because California has a much stronger basis of public health systems in the state, with public health departments in all 58 of its counties. And that system has pulled together quite well, but I would like to ask Kevin, it appeared to take a while to connect the public health system with Cal OES and the emergency response systems in the cities and counties. Is that right? Or is this just me observing?
My observation was that Cal OES and CDPH were operating jointly from day one.
Well, that's good to know. I think maybe not quite so well at the city and county level. And it's good to know that at the state level that was occurring.
Okay, very good. Thank you. The next question. We all know after a natural disaster, mutual aid is very important. And we were thinking, do you anticipate reduced mutual aid due to reluctance of staff operating away from their home base? That is, help from different areas to come into our disaster. Because of the pandemic, they would be reluctant to expose themselves to a new area. Has that been an issue for any of your emergency planning? Anyone?
I'll start. We haven't requested mutual aid because we know everyone, like Anne referenced, everyone is facing the same thing. And we likely have the resources we need. We just need to marshal their work in the right way so that they can address some of the issues. Maybe there's unique pieces where we might be requesting help, but we haven't reached out yet for that level of support. One thing I do want to add, and this comes off of Louise's last comment about this state coming together. People did come together during the first wave, and I say that because we are headlong in San Francisco in our second wave. And I think that we're seeing not a division, but people, as they understand it more, are becoming more relaxed. They think that they're not going to get it. And at the very time when our second wave is coming, we have people behaving in a way that may not be helping us keep the now second curve down. And that's something that we need to continue to emphasize, of what people can do and that they have a part in this. Unlike when you have an earthquake, things come crumbling down, people try and get back to work, but they're relying on others, the public servants, to get things going again. We are all now relying on one another, and I think that's a change for some of the public.
If I can, I just want to interrupt a moment here. I think we're all thinking about the COVID situation all the time. The question we want to be focusing on here is an earthquake. And so what would happen? So if the Hayward Fault goes right now, in the middle of this, what does that mean? And so I think, so like this mutual aid question, for example, is, normally you'll get help from Southern California. And the question is that going to be impeded by the current situation? And what else might be impeded by the current situation?
Got it. Thank you for the redirect. Yes, I would expect that it would be. I know that in the city we talk a lot about what is the thing that is most likely to do harm to our citizens. And COVID is certainly an imminent threat, but if we have individuals that are in collapsed structures or need to be rescued, my hope is that our partners, if we are calling for mutual aid from Southern California, is that they will come and they'll meet that response, because someone trapped in a collapsed building, they could die in 48 hours. Hopefully, we don't want anyone to get COVID, but that the survivability might be higher. And, you know, having the amount of space that would be required in order to do spacing of individuals, I think about some of the large work camps that would be necessary. That's all something that we would have to think about. But I would hope that if we put up the call, that mutual aid would still respond. Thanks, Bob.
Yeah,
Okay,
I wrestled with this question a little bit because you know, the mutual aid system in California is strong. It's been used effectively for many years. Our counties and cities know how to use it well, particularly law enforcement and fire. You know, send resources to adjacent jurisdictions on a regular basis during fire season. We see, you know, it's well publicized in the news when there's a large fire locally, you know, how far away these fire units come from Southern California to Northern California and vice versa. And so that is well practiced, it's well used, and it's a good use of resources and all of that. And the nature of the folks that respond, this is a bit more subjective, but it is fire and law, first responders, and if these folks, it's in their blood, if they see the need and are directed to do so, will respond. And I think some of what Bijan was describing is that we're in this situation. We're starting to get used to it as a community. And so as we're addressing this, if something, if a need pops up, then I would anticipate that the mutual aid system would go into effect as it has in the past. Of course, resources are strained. People will respond as they're able, but I think it would, my opinion is that it would work.
So from the FEMA perspective, and again, I want to state this is a moving target. So you know, I don't want to make it, you know, see like I'm the oracle for FEMA. I'm not in any way speaking for the whole agency. I'm just kind of giving you what I've observed and based on what things that have been communicated to us. But I agree. I think the mutual aid system is intact. I see it is working, but there are going to be adjustments. So on the FEMA side, you know, our mission is helping people before, during, and after disasters. And so our operations and our response divisions have been modifying our response activities and how we're going to be doing it. So for instance, public assistance, as Bijan mentioned, in other types of disasters and with earthquakes in the past, it's always been meeting firsthand and face-to-face with the survivors, and that it's the infrastructure and the buildings that are damaged. This whole disaster is a bizarro situation because it's completely opposite. We can't talk to the survivors, and yet we still need to do that. So FEMA has been developing, the agency as a whole, and then within each individual region, they've been developing ways to, you know, modify what our operations will be. So setting up a drive-through interaction and making appointments so we can, you know, social distance. So they're definitely figuring that out. It's a lot to sort out. But there are some other things that need to be considered as well. So Kevin, you were saying that there's a strong sense of duty and commitment to go out and respond, but that may end up making the situation more difficult. In Guam, where I was, when I was deployed out there, Guam is an island, and every community is its own science experiment, its own little island in terms of how they deal with this pandemic. Guam was in a situation, being an island, where they were on the path toward eradication because they could control who was coming in and out, just like New Zealand. And so one of the things that we had to do in going out there is we had to be tested first to make sure that we weren't put into quarantine for 2 weeks once we got out there. We were supposed to be going out there to help. We wanted to make sure that we could work, you know, telework from a hotel in quarantine for 2 weeks, but that was going to make us less effective. So I think some of the things that we need to be thinking about in terms of modifying our approach so that we are expedient and we can, you know, because certainly there is a time element to some of these response activities. but we don't want to make it worse. So thinking about, okay, what's going to be a streamlined process for testing emergency responders that are coming into a region that's been impacted, because we also don't want them to become sick and then take that back, or those people that are responding. And then one other observation is that, again, for FEMA, you can't even interview with FEMA unless you sign a waiver that says, you could be deployed at any time for any reason, anywhere. But in this instance, there were definitely some allowances made. For those of us that were deployed, we did have an option. Speaking for myself, I didn't, run to the front of the line, but when I was asked, I considered what my personal situation was, my family, and I just chose not to say no. I felt in, good conscience, yeah, I'm in a position, I can do this, so I will. But we were given more latitude than I think has happened in the past for other types of disasters. So I think it's going to be, and it's also, as Bijan, you mentioned, it's a rolling situation. So I think also it's going to depend on where we are in this pandemic and as it evolves. So I think it's one of those things we are all going to need to continuously reevaluate what the situation is, and what the appropriate response will be. As always, the situation itself will dictate what's appropriate. So some of those emergency response muscles are well exercised and ready, but we just need to kind of shift our view a little bit.
Yeah, I think that some of what you are leading into was another question about adapting the field response, and that's going to require social distancing and PPE, policies and that kind of thing. So that makes a lot of sense.
Okay, Louise.
Well, I've got a question about volunteers. FEMA, every disaster relies on volunteers. There's been efforts to train volunteers, etc. But in this situation, would indeed there need to be new protocols for testing the volunteers, for ensuring that they understand the circumstances that they're in? And a critical question would be medical assistance for the volunteers if they do get sick. And how would either Cal OES or FEMA respond to that? And who would be responsible?
Well, I can say, again, based on experience, before being sent out, FEMA has a system in place for aid. So, if we needed to be medevaced from the Pacific Islands, they've done that before. It's not cheap, but they can do that. And also in terms of the testing, another really interesting wrinkle. I'm not a social scientist, but I've found this whole situation very fascinating. But one of the aspects that we were tested, and that was voluntary, but there are legal questions involved. You can, personally, I have no problem being tested and sharing the results. I was negative when I got tested, but legally we were not required to do that. So, there was no way that anybody could tell. If I tested positive, theoretically, I could still show up for that deployment. I could have gotten on that plane and headed out and not said anything. So there are some really interesting complications that, and again, personally, I didn't have any problem doing those things. But again, I was really, I'm going to give my agency a shout out. I was impressed at the level of effort they took to make sure that we understood our rights as individuals, because FEMA is not the military. It's very organized, but we are still private citizens. And so but in the end, it's the first rule of survival is you have to look out for yourself. So I think it's going to be a combination of, taking steps to improve your own situation, making sure you're using the PPE, making sure you're wearing a mask and doing those things on your, because that's your responsibility. But and if you observe things that are not working, communicate that up and make sure that that's how we're all learning from all of this.
Thank you. Very
Okay, very good. I have many questions. I'm going to do one more, but I request the panelists to give somewhat brief responses, because I know Rob probably has quite a few questions from the audience, and we'll shift to him. So this is the last question from the list I have here from the board. And this one has to do with the what to do when their housing has been destroyed. In the past, we set up emergency sheltering, perhaps in a school gym, things of this nature. Now, due to the pandemic, is there a shift? That is, we will be encouraging more shelter in place versus going to a centralized locations because the idea of spread of the virus. Could the panelists comment on this? Has this paradigm shifted because of the pandemic?
I'll speak to that. We have always tried to encourage people to stay in their homes if possible, and related to an earthquake. And one of the pieces is even if the home may not have power, water, sewer, if there's which normally would be a yellow or red tag and they couldn't stay there, if it is structurally stable as determined by the Department of Inspection and inspectors, we would prefer people be there because it is a form of housing. And you're right, it provides some amount of social distancing. But if that's not possible, that's when we would rely, and we're fortunate because in San Francisco, we have a lot of hotel space and we could utilize what is available. But if we then needed to go to more of a congregate setting, which might be the normal environment, like after a campfire or one of the other larger fires, earthquake would be the same, we would have much more stringent policies on people coming in, how we would cohort them, just as Ann mentioned, some type of testing that would go on for people when they come in, even if it's just a basic temperature screening and answer some questions so that we can attempt to gauge individuals that are less likely to have something, put them in one area, and individuals that could be symptomatic, have them somewhere else so that we can manage any potential spread. But the amount of housing and space that will be required to do that is far more than what we had originally planned for. And so that's where some of our additional planning is taking place.
Okay, very good. Anyone else?
Having worked and lived in San Francisco, I went right to that policy of sheltering in your own home as the preferred option. From an earthquake, we don't anticipate necessarily large scale, massive evacuations, as a lot of people paint as a worst case scenario. But the recent briefing by the governor has been briefing from the State Operations Center on a daily basis or almost daily basis. And the director of our agency was also talking about plans for both initial, if necessary, congregate sheltering and accommodating social distancing considerations. And that would include certainly temperature checks and appropriate segregation of cohorts, whether they're COVID positive or negative, and also by family, mask required, deep cleaning procedures, individual boxed meals as opposed to buffet style, enhanced medical staffing, and addressing access and functional needs support services, all enhanced for initial congregate sheltering if need be. But the preferred current sheltering in this environment is non-congregate. So I think programs are being stood up in terms of finding hotels and individual sheltering. So, as needed, that is one approach.
Excellent, very good. Ann, would you have? No. Louise, any comment?
Well, I think this is very interesting, but it strikes me that these approaches need public education. They need to be communicated to the public so people know what to expect and know that setting up earthquake kits at home is going to be very important for them. So I think this can be amplified and extended, and the governor's press conferences are a good thing, but I think the local level mayors and city council and police chiefs and fire chiefs are a very important part of this team.
Okay, excellent. Okay, we had many more questions from the board, but time does not permit them. What I would like to do now is turn the meeting over to Rob because he has gone through many of the questions from the audience. So Rob, I'd like for you to pose the next several questions, please.
Okay, well, I'll take a couple from the audience, and then there's, I think, a few that of ours that will throw in the mix as well. But so here's one. So we're talking about, you know, the preferred is to shelter at home. But there's the anyway, there's the issue of tsunami evacuation. So the question is, near the beginning of the pandemic, the international tsunami community under UNESCO generated guidelines for tsunami evacuations during a pandemic. And so they want to know whether these guidelines were adopted or adapted for California.
I am aware of those and have seen them from ITIC and from our colleagues in, actually, I think it originated from the Puerto Rico director of the Tsunami Center in Puerto Rico, Christopher Hillebrand. And so it's something that is being looked at, but is not necessarily adopted as a policy per se. We have a very proactive tsunami education and emergency response program in California through our agency in conjunction with the California Geological Survey, and we meet with our 20 coastal counties twice annually. And so that is something that we would be discussing as a priority with that group. A tsunami is a very different animal than an earthquake in that, you know, even thinking back to our previous mutual aid discussion, counties and jurisdictions up and down the coast can't necessarily look to the adjacent coastal jurisdiction because a tsunami could be impacting the entire 1,000-mile coast of California at the same time. So it's something that you need to look inland for. And in terms of evacuation, we put out one thing that we have considered is providing lower level scenarios as an option. So that would, there's a worst case evacuation line that is public, but for the emergency management community, we're able to fine tune and provide information as an event is unfolding to potentially evacuate fewer people. So that's something that would support this kind of a response.
Okay, and so you would, and so generally, so you might evacuate fewer people, but then where would they, how would we just, I don't know, we don't need to get into the guidelines, but I think listeners might be interested in knowing sort of generally how you would approach it. So if we had if there was a big giant Aleutian earthquake right now and we have 6 hours warning that we could have a sizable tsunami hitting the entire coast, how might we deal with that a little differently, well, anyway, how would we be dealing with that under the current circumstance? And anybody can take that.
Yeah, I'll speak to that. You know, our current policies, which we developed in close contact with Kevin, and I'm thinking about, I'll just speak to kind of the western part of the city, although there are other parts that could be affected, is we know what the run-up would be. You would use the same procedures with our alerting mechanisms. And this gets to something I mentioned earlier about what is most likely to cause harm in the most immediate way. And so for tsunami evacuation, it would similarly be get your stuff, get out of the area, you know, proceed with caution, do your best to maintain social distancing, but at the same time, get out of the area. And then once individuals are out, we hope, and we've minimized that, then it would be those individuals and then how we're going to manage them in some type of shelter or environment and make sure to get them the information that they need in a way that still has some of the social distancing.
May I ask a question?
Yes.
What kinds of communication would you use for the local communities, especially if, as Kevin says, you were targeting the evacuation more carefully so fewer people would have to leave?
We have 2 different forms of communication in San Francisco in our public notification system. One is targeted with phones in a particular geographic area. And then we also use the wireless emergency alert, which as well uses cell phone towers in the affected area, which is then linked to any cell phone that's connected, irrespective of the type of device. And we're then providing multilingual messaging, which we already have written, again, in partnership with Kevin and his team, to give the clearest instructions we can to individuals in our threshold languages to let them know where they need to go effectively to get out of the inundation area.
And of course, everyone's getting the same information from the National Tsunami Warning Center. We're getting that directly. It's going out to the public, and the media is picking that up, and they're pretty versed on how to use that information.
So actually, here's a good question. Anyway, in general, we were talking about sheltering where we might need to shelter people. There could be a fire after the earthquake. There could be a tsunami that actually occurred, and so they can't shelter in place. So it's great that you have a lot of hotels, but what contingencies are being considered given the fact that many hotels would be structurally compromised by a seismic event?
So fortunately, yes, I don't want to minimize that we are likely to lose a lot of the initial housing stock. And for the first several hours, people are going to be evacuating and they're not going to go back inside, whether it's because they aren't sure the condition of the building, whether they're afraid. And so we have, as part of the structural assessment program, we have that in San Francisco. We also have some of the stationary engineers doing some of the initial assessments. And the name of the program isn't coming off the top of my head. Kevin, what's the name of the program where you can pre-inspect the buildings?
The business, I can't think of it either, sorry.
It's BORP.
Thank you. The
Recovery Program.
Yes.
You've got it.
Thank you.
Yes.
Many memories together. So we really encourage different groups to use the BORP program so they understand what the likelihood of resilience is of their building, know where likely structural issues may occur. So those stationary engineers can go right to those spots to begin with, and then get their engineers on staff or on contract to then come out and then assist with that to hopefully speed up the process. But I totally recognize that in the first several hours, 24 hours, we are going to have a huge housing issue, and then that becomes a feeding issue with people that have nowhere to go. And if it's during the summer in San Francisco, it's really cold, and so people are then going to need a place to go and be fed. And so those are challenges that we recognize.
Good. I'm trying to figure out how to deal. I have several comments here from if I guess I could identify the person, Forrest Lanning, FEMA's earthquake response liaison. But he's making several comments on these. But with regard to the mass care thing, he was saying that again, FEMA would push to do mass care with most people staying in homes where possible, distribute food and water rather than have a central location for people to come to. So that's pretty much what people were saying. Anyway, and I would love to be able to activate him here. I don't know if I can. In any event, I'm just letting you know that we have several comments from the, and it's good to know that we have a earthquake response liaison, and that he's trying to communicate with us. I had, let's see. So let me move on to one of our questions I think that many members would be interested in that we haven't touched on, and this relates to the previous question. Just in general, building inspection processes. So that's a big complication right after an earthquake in normal times, is trying to deal with that. And here we have this. Again, the issues of people being sheltered and whether we want to have contact with the occupants of these buildings and so on. So what's the, in what ways are you thinking about modifying the building inspection processes after an earthquake under the current circumstance?
I guess from the state, we have the cadre of building inspectors that this SAP structural assessment program, who would go out and do damage inspections. And of course, we're going to have to have policies in place for field response that accommodate social distancing, whether those folks are traveling alone versus together, et cetera, and practice providing them with proper PPE protection. So, and some training as to how to do that. So that's additional training, and that's, just accommodating the inspections using social distancing is a basic premise.
I know in Puerto Rico, they've been doing for FEMA individual assistance applicants, they've been doing either some remote inspections, or they've been contacting the individual to self-report and take photos. And there have been some issues with regard to that. And I was just wondering if there were similar. It sounds like that's not the intent here. Is that you expect to go out in person?
No, I'm not eliminating that. And it would be interesting to. I was in Puerto Rico actually in February in response to the earthquakes for a couple of weeks, and that was just just prior to a lot of this unfolding in terms of the COVID-19. So it's interesting to hear that. I had not heard that.
Another aspect of this, so we're talking about the public safety aspect, but there's also the science and engineering learning, which is what EERI and several of our, I'm sure people on the call are. And the recent events in Magna in Utah, and then there was the event. There have been a series of events in Nevada. And what I think what's happened is the number of people that are going out, there are fewer. And again, it's before people go out, trying to get a better sense of what's the level of damage. So like for the Nevada event, it was a large event, and certainly the Idaho event as well. They were larger, but there wasn't as much damage. There were people that were going out, but again, in the science and engineering community, as scientists and engineers, we want to go out and we want to collect the data, and we want to do those things because we learn from those things. EERI has a whole learning from earthquake series. But again, I think it's pumping the brakes a little bit. And, I think that's a re-education, Louise, to your point of, how do we communicate? It depends on the audience. And I think certainly the type of inspections and the type of information that's going to be needed is going to be the same. But we need to start thinking about how, what kind of trainings, EERI or a clearinghouse or each state can provide, or in the engineering community, what kind of trainings how can we modify that to include or expand the safety aspect instead of just a hard hat and steel toe boots. We also need to be thinking about PPE. And again, it's not just protecting ourselves, it's making sure that we're not infecting and spreading making the situation worse with our own actions. So again, I think it's a work in progress, and it's going to require some thought. And again, the situation itself is going to dictate what's appropriate.
Well, good. Yeah. Yes, and I know in Magna, they were doing some remote inspections. But I just think of all the scenarios for the big Hayward Fault earthquake and how disordered and chaotic everything will be, and even without COVID, all the things that we think we know how to do will be pushed to the limits. And it's very hard to imagine how trying to do all those things and do all the improvising that we need to do is going to function in an environment where we're also trying to stay as far away from each other as possible.
Yeah, I think we have catastrophic response plans in place using, considering the Bay Area, Southern California, or North Coast earthquake and tsunami. And taking those as a baseline and marrying that with, you know, what we're learning through COVID and deconflicting some of those issues is going to be something that we're learning as we go to a large extent on a lot of this. So those are great points, I think.
Yeah. So I'm looking at the time, and I think we probably should wrap this up. Does anybody have any burning thing that you really want to tell us all, something key that we've missed here, some last message?
Well, I think one thing I'd like to point out is, and it's not just what we're thinking about response, but I'm trying to think of, you know, more holistically. Now that I've had a chance to digest the situation myself, I'm starting to rethink, you know, what are the major initiatives and programs, things like functional recovery. For functional recovery, we're talking about, you know, community resilience and mitigation. And, you know, the conversations that I've been involved in over the last couple of years have been focused on, you know, identifying what are the critical facilities, what are the critical functions, what are the within San Francisco, what are the critical say services that are provided, where are they located, which buildings, and not even all the services within a specific program. What are the most important ones that are needed to get to improve resiliency and functional recovery? But now with all of us working at home, and, you know, I mean, it used to be, well, it was the, in the, say the building inspectors department, we had, 3 key people who maybe would be out going and doing building inspection. So that part of this, this particular address needs to be, this building needs to be able to function immediately during and after an earthquake. Well, the people that are doing that function are working from home. So, is that physical structure really what, and we haven't figured out functional recovery even without COVID. But so I would like to throw that out to the audience as well, is that, let's start rethinking how is this, it's not just how we're going to respond, but how is this going to impact how we've traditionally thought about things like recovery and mitigation? Because one of the questions we're being asked is, will there be, there's a federal disaster declaration, but will that include mitigation funding? I don't have an answer to that. So, but it's certainly a fair question.
Yeah, and Louise didn't ask what happens if all the cell towers go down and we can't do any of the communications.
That's exactly what I would ask. Earthquakes are very different, and it depends on communication, and we're depending on the use of technology for collaboration. So Kevin, how do we do a virtual EOC if the Wi-Fi towers are down and we totally lost communication with one section of the state?
Or our power is out.
Or the power is out. I mean, we know that lifelines are critical in earthquakes, and the difficulty is that, using WEA, for example, if the cell towers are down and the communications is out, WEA is not available. And even so, the broadband capability of WEA is far more limited than the use to which we should put it, and the need that is actually required for response in a massive, 9 million people area like the Bay Area.
Well, you just thrown 4 catastrophic events at me in one question. So I mean, we had a lot of experience with public safety power shutdowns last summer, and listening to the governor last week, I was encouraged that they are pressing PG&E and others to, there's movement on that front to mitigate that more, and there are plans in place for that, but we don't have all the answers because these are difficult situations. So it's something that there are contingencies for. If cell phone towers going down is going to be a disaster in and of itself. So I have my carrier pigeon sitting right here, but no.
I love it.
Some of that is the education ahead of time, and I can't remember, Louise, if it was you or Anne who mentioned this. we are looking at door hangers and ways that we can give people the information that they need ahead of time. So in the face of no information, at least I know what my default action is, and it's go to high ground. Simple as it is, just get out of the way. And hopefully that's what we are getting people to know.
And I would like to add, to build on Louise's point, that's a fantastic observation about, when systems go down. And, anybody who knows me knows I've long preached about the importance of, information sharing and coordination. And this is a great opportunity to, one of the best practices is to make sure that you have your own data and whatever information that you need stored locally on a device. It may not be the most up-to-date and current, but if things go haywired, you've got what you need to make some maps and decision support tools. And this recommendation comes from Lori Peltz-Lewis from the U.S. Forest Service. It's something she's done for years. And I think it's a fantastic idea. And practicing with those things, I think continuing to build trust and relationships in these kinds of meetings where we all know who each other are. And then one other interesting observation, I host a bi-weekly call. And last week we had David Waldon, who was talking about some of the USGS products. And somebody pointed out that, cell phones, you can download all kinds of apps on your phone. And there's, in your settings, there's something where you can tell your phone, your operating system, if I don't use this app for a long period of time, delete it. And it's binary, it's on or off. Well, earthquakes don't happen very often. So somebody could download an earthquake early warning or some other type of earthquake or notification system. We all know earthquakes, major big earthquakes don't happen very often. So there's a possibility that that application could be deleted from your phone. So it was a really good wow moment where we should be, talking to developers and technology folks and all the brainiacs that are out there are developing these tools that we all use and that are so helpful. But here's a gap that nobody really thought of. If you're designing one of these kinds of tools, make sure that it has a feature where if it doesn't get used very often, keep it. So there's so many lessons we're learning from all this. And, I think that's why I really appreciate EERI hosting this conversation, because there's a lot that we can all learn from each other.
Yeah, so, well, thank you. So I'm, again, being mindful of the time. And I guess I'll just add, it sounds like if the earth starts shaking right now, along with everything else, make sure that you have your mask and your hand sanitizer handy to grab as you go out the door. And that actually would help a lot. So I'm going to turn it back over to Volkan now to wrap up the meeting. Thank you, everybody.
Great. Well, I would like to thank all of our panelists and our speakers. I really enjoyed the discussions, and I'm sure that our members enjoyed it as well. I encourage all of our members to email us with any questions that they have. They can email to any of our board members. We are, in a sense, representative of our members, and we would like to get their feedbacks for our next event to fulfill whatever they would like to hear from us. With that, I would like to close the meeting. Thank you, everyone.
Thank you.
Bye-bye.
Bye.
Bye.